Hello, my name is Amanda Reeves, and I will be doing my Quality Management PDSA project presentation on Certified Nursing Assistants in the Intensive Care Unit. Issue identification. The potential change project topic I will be exploring is the need for a Certified Nursing Assistant, which I'll be referring to as a CNA, in the Intensive Care Unit, which I will be referring to as ICU, of our hospital. Currently, I work for a small community hospital located in a low-poverty area of Hemet, California. In the ICU of my hospital, registered nurses are required to provide all care to their patients without the help of a CNA, turning team, or rotation beds. Registered nurses are having to turn sedated, intubated, and sometimes obese patients by themselves. For many patients in the ICU, repositioning, turning, and frequent care is crucial to recovery. This issue has left staff and with bad morale against the facility and overall increased back injuries in the ICU. I would like to implement a solution plan that presents a potential change in policy to integrate resources in helping ICU nurses frequently turn patients and overall increase the quality patient-centered care required in the ICU. According to www.medicare.gov, Hemet Valley Medical Center is a one-star hospital, meaning that my facility is not achieving national or California averages in the 11 core measures. Not having CNAs in the ICU contribute to the challenge of meeting these core measures. As a result, we are not receiving reimbursements from Medicare, and this quality standard is not being met. According to William G. et al., who researched activities and issues of the critical care nurse, findings that major issues seen in the ICU were working conditions. Secondly, was formal practices, guidelines, and competencies. And also the top third one was staffing levels. Not having a CNA, turning team, or charge nurse also contributes to these issues. Lastly, Zawara and O'Leary did a research based on team nursing, which includes the doctor, the nurse, and the CNA. This research concluded that team-based nursing improves patient outcomes, decreases the cost of facility, and improves team satisfaction. Quality variance. Excuse me. In the ICU, nurses are taking care of critically ill patients who are suffering from serious life-threatening conditions. This is a specialty area that promotes high-quality nursing care. In the ICU, these patients are at higher risk of receiving pressure ulcers, ventilator-acquired pneumonia, DVTs, and also other hospital-acquired illnesses. So the quality variance evidence analysis in my facility is the inconsistency of assistance in the ICU, such as a CNA, charge nurse, turning teams, or rotation beds. This decreases patient quality care, increases injury, and increases stress in unhealthy work environments. On the other hand, performance centers seen at other facilities, as you see adequate resources to assist nurses in the ICU, such as CNAs, charge nurses, are most recently seeing turning teams in the ICU. This increases adequate patient care, and when nurses have resources, they're happy, and it's a stress-free work environment, and nurses want to stay at your facility. Root cause analysis. So what is the basic problem that we're dealing with? Well, leadership and management are not scheduling CNAs in the ICU and also not substituting the CNA for anything such as a constant charge nurse or a turning team. Why did this happen? Well, I think all comes down to patient safety risks. We recently had an incident where a CNA turned an intubated patient, accidentally extubated them. We're seeing CNAs lack competency with the critical ill patients, staffing issues, budgeting issues, and also we're seeing leadership and management have these attitudes and beliefs that maybe a CNA isn't needed in the ICU. So how do we prevent patient safety risks from happening? Well, we want to make sure the nurses are overseeing and evaluating CNA performances. We want to make sure that the CNA is performing tasks within their scope of practice, that they're trained appropriately by licensed staff, and we're implementing ongoing monitoring to assure compliance with certain tasks. If they are not going to provide a CNA, we want to either see a constant charge nurse there, turning teams, or even maybe investing in rotation beds. And also providing in-services for the competencies lacked by the CNAs. So scope. What does this problem impact? Who does this problem impact? First and foremost is the patient. Is the patient getting that quality care? Are they being turned every 2 hours? Are they being cleaned up when they need to be? You know, is our documenting getting done on time? All of those boil down to the patient and the quality care of the patient. Secondly, is the nurses. When the nurses have increased workload, we have increased stress, it boils down to our patient care as well. Also, CNAs, we lack that position for that CNA in the ICU. Excuse me. The facility as a whole, going back to those Medicare reimbursements, achieving those quality patient outcomes, and also management, because nurses are going to the management with our complaints and our issues, and they have to deal with that on a bigger scope. So solution and implementation. Well, what is the solution? We want to either have a CNA scheduled every shift in the ICU. We want to always see a charge nurse, if not, and also either a dedicated turning team for each shift. So what is our improvement goal? Well, we want to see the patient receive quality patient-centered care, and we want to see an increase in Medicare reimbursement. We want to see the nursing staff receiving those adequate resources, so the patient care, we can decrease workload stress, and we can provide a healthy work environment. So how do we implement? Well, staffing needs to provide a CNA, a charge nurse, or a dedicated turning team. We need to evaluate CNA competency with critically ill patients. We need to provide those services for the CNAs. We need to make sure the nurse is providing direct observation of the CNA duties and evaluating their performance and making sure they are doing things correctly. Making sure the nurse is always there providing that patient care with the CNA. The CNA is there to help us with that heavy workload, having the second pair of hands, but the nurse overall needs to be giving that patient-centered care for the patient. And we also need to coordinate turning teams. A research done by Mary Still et al. Did a research study on turning teams in her facility. And she concluded that dedicating a turning team to turn patients every 2 hours dramatically decreased the incidence of pressure ulcers at her facility. Also, going back to William G. et al., he also stated in his research that leadership and management who are making these policy decisions need to make sure that they're acknowledging and accommodating for the changing needs and interests of a critical care nurse. So as we see these high acuity patients, this increased workload, we're seeing that we're not having enough resources to help us achieve and to deal with that type of issues and workload. So we need to make sure that our decisions are being based on what the critical care nurse needs. Analysis. So the data collection that we will need to determine if the solution meets the goal is we need to look at the competencies that CNAs might lack. We need to provide in-services and then see how those in-services work with the CNAs out in the field. We need to make sure we're evaluating that CNA performance, even overall evaluating the need for a CNA in the ICU. We need to analyze patient outcomes, work environment, nursing attitudes, and also we need to look back at scores for our facility. Are we meeting those patient safety goals, those infection disease goals, and the Medicare reimbursement? So the next step, so measures that will be taken based on the analysis of the effectiveness of the change. We want to make sure that we hopefully can get better than a one-star hospital. Those are going to be dependent on our quality patient outcomes, our surveys that those patients get in the mail, and also achieving patient safety goals. We need to also work with HR, make sure we're hiring staff to meet the needs of the ICU, the CNA, charge nurse, turning teams, etc. And then we also need to make sure we're doing those annual in-services that meet the needs of the evolving healthcare. All right, those are my references. Thank you so much.